Okay, so this is week 9, and we are in our second week of the respiratory system. And last week in lab, we did the models. We went through the lungs, the airways, the histology, anatomical locations and features of the organs. So now we're switching to the second lab of the respiratory tract, which is known for pulmonary function testing. Okay, now, when people do pulmonary function tests, it's kind of like EKGs. The first one you do is to get a baseline, and then you will do them every year or every few months or on a certain kind of schedule. And as you see changes in the PFT readout, which are those volumes and capacities, that is how you start to gauge how the progression of the disease is occurring, okay? You can also be using the PFTs for a diagnostic tool. We are not doing anything like that in this class. So our goal is to learn what are these pulmonary function tests, what are the standard things we're trying to, data points we're getting and what they mean, and we're staying right there, okay? Now, the old school way to do this is showed in this picture here. And you used to have a tube attached to your mouth, you'd pinch your nose, and it would connect to a water bath. And as you would breathe, the air that would be trapped in this bell would get sucked in, and you would then move up and down with the bell. And as it moved up and down, it was attached to a pin that would then write on the paper as the paper was rolling out. And so at the end of the test, you'd have this readout where the pen gave you information, okay? And it goes through a little bit of, you usually take a few breaths, get acclimated to being on the mouthpiece, acclimated to having your nose plugged, and then you have to have a coach. And when you do a pulmonary function test, you are going to usually ask the person, take a few breaths, get those tidal volumes, those natural inhales and exhales. Granted, if the person's a little anxious, if the person's a little excited because they know what's going on, those might be a little bit inflated and bigger than normal, all right? And then you're gonna usually ask the person, take a big inhale, and you're gonna ask them to get the biggest amount of air they can in their lungs. And so because of how we breathe, remember, we wanna try to open up our chest, elevate the scapula, really get really big, make our chest as big as possible to get as much air into the lungs as possible, right? And when we measure that, that's going to give us that inspiratory reserve volume, okay? And once you have the person taking that big breath, then you want to say, now exhale, exhale, exhale. And you're going to coach them, and you'll probably see them curl up and squeeze, and they're going to try to exhale as much air out as they possibly can. And they'll get to a point where they're like, you know, like almost making themselves pass out from the exhale. And then you'll have them just try to return to some normal breathing. You may ask them to, again, continue to breathe for a little bit, and let's do that again. And may ask them to take the test 2 or 3 times, because again, if someone starts to hiccup or cough in the middle of their test, you don't want to use that measurement when you're getting your capacities, okay? So as the terms that are in bold on the slide from your lab manual are listed, you need to know what those terms are, and you need to be able to apply them, all right? To the graph. And again, you're only responsible for the graph that is given to you in your book and given to you in your lab manual. So your goal is to be able to, on this graph, be able to potentially point out any of the volumes or any of the capacities that are listed from your lab manual, okay? So again, the test went, I asked someone to take a few breaths. In this example, they exhaled out, took a breath, then inhaled all the way up, and then did a maximal exhale all the way down, and then took a few breaths, okay? So when we start to try to label things on the mat, or the graph, the inhaling, exhaling breaths that are not anything beyond a normal breath, those are gonna be our tidal volumes, okay? Anything that's from, again, the top of the tidal volume and an inhalation of extra air to the top, So this purple part here, that would be your inspiratory reserve volume. That's the amount of air you can potentially get if you really try to move your chest wall, if you really try to pull open your lungs to the biggest volume possible. Okay, so if I was wearing a corset, if I was pregnant, this would not be able to get as high. And the reason why is because I would be limiting my ability to open my chest, open my lungs, pull down on them, and I would not be able to get this as high. Okay. The exhale, all right, is going to, again, go through the tidal volume. And then once you get from the end of the bottom of the tidal volume and go down, this is the amount of exhale you can get if you really try to squeeze and, again, pull your abdominal organs up into that thoracic cavity, really try to push in and compress your thoracic cavity and really make your airways as small as possible. And that's your expiratory reserve volume. Okay. Now, we don't know for sure, and this is why, again, we do measurements on lots and lots of people. We get standard kind of guesstimations on for your height, for your age, for your gender. Your airways should have some amount of fluid or air left inside, and that's going to be the residual or the dead airspace volume. And that's represented here. Okay, so your volumes again, tidal volume, your inspiratory reserve volume, your expiratory reserve volume, and a estimated, a calculated, a guess in some ways, your residual volume. All right. Those volumes, when we start to add them together, we can now form and make capacities. So one of our first capacities is how much air am I capable of taking into my lungs? So when my lungs are in a resting position, how much can I move in large and Boyle's law and get into my lungs? So do I have an inhale portion and tidal volume? Yes. Do I have inhale or increased air coming in inspiratory reserve? Yes. So if you take tidal volume and inspiratory reserve volume together, add those two together, that is your inspiratory capacity. That's the amount of air we are saying you are capable of bringing into your lungs for your age, for your height, for your gender. What?
You only take the partial portions.
No partial portions. You take it. This is 500 mils. If this is 1 mil, your inspiratory capacity is 500 plus 1. So 1.5 liters or 1,500 milliliters. Okay. All right. What is normally left in your lungs of air when you're doing normal breaths is usually the expiratory reserve and the residual volume. So these two capacities, all right, are your functional residual capacities, because when you're breathing right now, you are leaving in your lungs the residual volume and this extra expiratory reserve that you're not currently trying to blow out at this instance. So these two together make that functional residual capacity. Vital capacity is going to be tidal volume, inspiratory reserve, and expiratory reserve all added together. Vital capacity is for your lungs. What is the capacity of moving air? So it's taking the inhales and the exhales, putting them all together, all those volumes, and saying your lungs are capable of moving this much air. And the residual volume is left out. Total lung capacity in addition of all lungs. Okay? So you need to get on here. If I went to some segments on the teacher, need question, only question. If it's asking you great volume, what is this area of net? You would eventually say, is this volume? If I'm asking you for what to make two or more of these, and anytime two or more volumes together, you're going to get capacity. Okay, now moving on. This is okay, now, as I said, when we do pulmonary tests now, we do them as a direct. You get a little near the body, you have a little mouth kicking out the word. You still push it the same way. Take a few breaths, then take a few squeeze, and you're going to get, instead of this black paper that pen was writing as we're going around, you're going to get souls on breath. Okay? You do not have to take this breath, but note that this is just a different way. Instead of the information as a flow and keeps going, this is saying the information, same volume, the same capacities, but you're representing another format. Okay? What these two layers is inhale and do some real tests. So I would go to the scene and see the coaching that requires you to do and use that to just look to see if you can actually measure what your weight is. Capacities or how you look like shit, right? Or and yes. But unfortunately, we're going to do that scout and breathe in this room or at home. But as soon as they come to say a couple of these terms, people so we build on it, and then it gets time for your next class. How you have to diagnose and disease, you have to know that this is that you'll have to be in the environment changing first inside. This is what I'm working with. So if you do that online, that's all I have. I will send you and go to you have questions, Capacities. As I said, you want to do the board and press the one time each. So you don't have to draw it, label it, rebook, and just give some numbers. Maybe about what the two guys be, which guys be.